I want to talk to you today about something a great many older adults notice, often at the end of the day, and frequently shrug off as just a normal part of getting older or being on their feet too long, swelling in the ankles and feet. You take off your shoes and socks in the evening and find your ankles puffy, your feet swollen, the sock leaving a deep mark in the skin, maybe your shoes feeling tight. And while swelling in the feet and ankles is indeed common, and often has a simple, harmless cause, it's one of those symptoms that genuinely deserves attention because it can be your body's way of signaling something about your heart, your kidneys, your veins, your liver, or your medications, some of which need proper attention. So today I want to explain what causes swelling, what doctors call edema, why it happens more as we age, the range of causes from harmless to important, why it matters, what you can do, and crucially, when swelling is a reason to see your doctor, including the warning signs that mean you shouldn't wait. And I'll keep this calm and balanced throughout, because much swelling is benign and manageable. But knowing when it's a signal worth heeding genuinely matters for your health. Let me start with what swelling actually is, because understanding it makes all the causes make sense. Swelling, or edema, is the buildup of excess fluid in your body's tissues, and it tends to collect in the lowest parts of the body because of gravity, which is why it shows up most in the feet, ankles, and lower legs, especially after you've been upright during the day. Normally, your body maintains a careful balance of fluid. Fluid moves out of your small blood vessels into the tissues to nourish them, and then moves back. And your circulation, your veins, your lymphatic system, and your kidneys all work to keep this balance and to return fluid to where it belongs. Swelling happens when that balance is disturbed, when too much fluid leaks into the tissues, or when the systems that should return or remove the fluid aren't keeping up. So, edema is excess fluid pooling in the tissues, usually in the feet and ankles due to gravity, and it occurs when something disrupts the body's fluid balance or its ability to move fluid back where it belongs. And because several different systems are involved in that balance, the heart, the veins, the kidneys, the liver, the lymphatic system, swelling can arise from problems in any of them, which is exactly why it can be a meaningful signal and why finding the cause matters. Let me start with the common, often harmless causes, because they cover many cases and I want to reassure you before we get to the more important ones. Simply being on your feet a lot, standing or sitting for long periods, especially in one position, lets fluid pool in the lower legs by gravity, causing mild swelling that typically goes down with rest and elevation. This is very common and usually harmless. Hot weather can cause mild swelling. Sitting still for a long time, like on a long flight or car journey, causes the feet to swell. Being overweight contributes. And importantly, many medications cause fluid retention and swelling as a side effect, including some blood pressure medications, particularly certain calcium channel blockers, some pain medications like the anti-inflammatory kind, certain diabetes medications, steroids, and others. So a medication can be a common and overlooked cause. There's also a very common, generally benign condition where the veins in the legs don't return blood as efficiently as they should, called venous insufficiency, often related to aging or varicose veins, which causes the legs and ankles to swell, especially by the end of the day, along with sometimes achiness and skin changes. While this is usually not dangerous in itself, it's worth knowing about and managing. So a great deal of foot and ankle swelling is due to these common causes: being on your feet, heat, inactivity, weight, medications, and benign vein problems, and much of it is manageable. So please don't assume swelling necessarily means something serious. Often, it's one of these ordinary causes. But now let me turn to the more important causes, the reasons swelling isn't always harmless and deserves attention, because some of these need proper medical care. The first and one of the most important is heart problems, particularly heart failure. As I've discussed elsewhere, heart failure means the heart isn't pumping as efficiently as it should, so blood and fluid can back up. And one of the classic signs is swelling in the feet, ankles, and legs, often in both legs, as fluid accumulates. Heart-related swelling often comes with other signs like shortness of breath, especially on exertion or when lying flat, fatigue, and sometimes weight gain from the fluid. And it's common in older adults and very important to recognize and treat. So swelling, especially with breathlessness and fatigue, can be a sign of the heart needing attention, which is a major reason to take swelling seriously. The second important cause is kidney problems. The kidneys regulate the body's fluid and salt balance, so when they aren't working well, fluid can build up and cause swelling, often noticeable in the legs and sometimes around the eyes. The third is liver problems, which can affect the proteins that help keep fluid in the blood vessels and cause fluid to accumulate, sometimes in the legs and abdomen. So heart, kidney, and liver conditions are the important systemic causes of swelling, each needing proper medical attention, which is exactly why persistent or significant swelling warrants a doctor's evaluation to determine the cause. Let me give you a few more important things to know about swelling, because the pattern of the swelling gives real clues. One crucial distinction is whether the swelling is in both legs or just one, because this genuinely matters. Swelling in both legs and ankles together, symmetrically, more often points to the body-wide causes like heart, kidney, or liver problems, or to medications, or being on your feet. But swelling in just one leg, especially if it comes on relatively suddenly and is accompanied by pain, tenderness, warmth, or redness in that leg, is a particular warning sign because it can indicate a blood clot in the deep veins of the leg called a deep vein thrombosis, which is a serious condition that needs urgent medical attention because such a clot can travel to the lungs and become life-threatening. So one-sided leg swelling, particularly with pain, warmth, or redness, is a red flag that warrants prompt medical care, not waiting. Another important point is that swelling accompanied by shortness of breath, especially sudden or severe breathlessness, is a warning sign that needs prompt attention because it can signal a heart problem or fluid on the lungs or a clot that has traveled to the lungs. So while much swelling is benign, the patterns of one-sided leg swelling with pain or warmth and swelling with breathlessness are specific warning signs that mean you should seek medical care promptly rather than dismissing the swelling. Now let me be clear about when to see your doctor about swelling, because that's the actionable heart of this. See your doctor about swelling if it's persistent, if it's new or worsening, if it doesn't go down with rest and elevation overnight, if it's significant, or if it's affecting both legs, because persistent or significant swelling warrants finding the cause, which could be your heart, kidneys, liver, veins, or medications. Definitely mention swelling that comes with other symptoms, because the accompanying signs are revealing. Swelling with shortness of breath, fatigue, or unexplained weight. Gain points toward the heart and needs evaluation. Swelling with changes in your urine points toward the kidneys, and seek prompt or urgent medical attention for the warning signs I described. Swelling in just one leg, especially with pain, tenderness, warmth, or redness, which could be a dangerous blood clot, and swelling accompanied by shortness of breath, chest pain, or difficulty breathing, which could signal a serious heart or lung problem. Also see your doctor if swelling comes with skin that's breaking down, weeping, or showing signs of infection, since long-standing swelling can affect the skin. The doctor will examine you, ask about the pattern and other symptoms, review your medications, and often do some tests of your heart, kidneys, and other systems to find the cause and treat it. So the framework is persistent, significant, worsening, or symptom-accompanied swelling warrants seeing your doctor, and one-sided leg swelling with pain or warmth, or swelling with breathlessness or chest pain, warrants urgent care. Don't simply ignore meaningful swelling because it can be an important signal. Let me give you the practical things you can do, both to reduce ordinary swelling and to support your treatment, because for benign swelling, there's a lot that helps. First, elevate your legs, raising your feet and legs above the level of your heart for periods during the day, and propping them up when resting helps gravity drain the pooled fluid back, which genuinely reduces swelling. Second, move and avoid prolonged stillness. Don't sit or stand in one position for too long. Move your legs, walk, flex your ankles, and take breaks to move, because muscle movement helps pump fluid back up out of the legs. Third, compression stockings, which gently squeeze the legs to help return fluid and prevent pooling, are genuinely helpful for swelling from venous causes and being on your feet, and your doctor can advise whether they're right for you. Fourth, reduce excess salt in your diet, because salt makes the body retain fluid, so cutting back on salty and processed foods can reduce swelling, which is especially relevant for heart and kidney-related swelling. Fifth, maintain a healthy weight, which reduces the load and improves circulation. Sixth, review your medications with your doctor if you suspect one is causing swelling, since it may be adjustable, without stopping anything on your own. And seventh, if your swelling is from an underlying condition like heart, kidney, or liver problems, the most important thing is treating that condition with your doctor. which often includes specific measures and sometimes medications like water pills to remove excess fluid. So for benign swelling, elevation, movement, compression stockings, reducing salt, and weight management help, while swelling from a medical condition is addressed mainly by treating that condition. Let me say a word about caring for swollen legs and skin, because long-standing swelling needs attention to prevent problems. When legs are chronically swollen, the skin can become stretched, fragile, dry, and prone to breakdown, and fluid can sometimes weep through the skin, and the skin can become infected, all of which are more serious in older adults whose skin heals slowly. So if you have chronic swelling, take care of the skin on your legs and feet. Keep it clean and moisturized, protect it from injury, watch for any breaks, sores, redness, or signs of infection, and see your doctor promptly if the skin is breaking down, weeping, or looks infected, because skin problems on chronically swollen legs can become serious and need proper care. This is part of why managing the swelling itself and getting its cause addressed matters not just for comfort, but to protect the skin and prevent complications. So along with treating the swelling and its cause, look after the skin on your swollen legs and feet. Let me paint you a picture of how this commonly plays out, because it shows both the benign and the important cases. Picture a woman in her 70s whose ankles swell by the end of each day, going down overnight with no other symptoms. She's on her feet a lot, takes a blood pressure medication known to sometimes cause mild swelling, and has some age-related vein changes. She mentions it to her doctor, who examines her, confirms it's the benign combination of being on her feet, her medication, and venous changes, and helps her manage it with leg elevation, compression stockings, moving more, and reviewing whether her medication could be adjusted, and the swelling improves. That's the reassuring common case. Now picture a man in his 70s whose legs and ankles have become increasingly swollen over weeks, in both legs, and who's also noticed he's more breathless than usual climbing stairs, more tired, and has gained some weight. He, or his family, recognizes that swelling plus breathlessness and fatigue points toward the heart, and he sees his doctor, who diagnoses heart failure and starts treatment, which reduces the fluid, eases his breathing, and addresses the underlying heart problem, catching and managing something important. And in a third, urgent picture, someone with sudden swelling, pain, warmth, and redness in just one leg recognizes the warning sign of a possible blood clot and seeks urgent care, where it's diagnosed and treated before it can become dangerous. The contrast is the lesson. Much swelling is benign and manageable, but swelling with breathlessness points to the heart, and one-sided painful swelling can mean a clot, so recognizing the patterns and getting the right level of care matters. And let me speak directly to those of you caring for or close to an older person, because swelling is something you might notice, and that carries real signals. You might see a loved one's ankles and feet swollen, their socks leaving deep marks, their shoes tight, or notice the swelling along with breathlessness, fatigue, or weight gain. You can help by recognizing that while much swelling is benign, persistent, significant, or worsening swelling warrants a doctor's visit to find the cause, and you can gently encourage that. Be especially alert to the patterns that need prompt attention. Swelling with shortness of breath, fatigue, or weight gain, which points to the heart, and one-sided leg swelling with pain, warmth, or redness, which can mean a dangerous blood clot needing urgent care. You can help with the practical measures for benign swelling, encouraging leg elevation, movement, compression stockings if advised, reducing salt, and reviewing medications with the doctor. And you can help care for the skin on chronically swollen legs and watch for skin breakdown or infection. Helping a loved one take meaningful swelling seriously, recognize the warning patterns, and get the right care can catch important conditions like heart failure or a blood clot, while managing benign swelling for their comfort and skin health. Let me draw this all together. Swelling in the ankles and feet, edema, is the buildup of excess fluid in the tissues, pooling in the lowest parts of the body by gravity, and it happens when the body's fluid balance or its ability to return fluid is disturbed. Much swelling is common and benign, from being on your feet, heat, inactivity, being overweight, medications, or benign vein problems. But swelling isn't always harmless. It can be an important signal of heart problems like heart failure, especially when it comes with breathlessness, fatigue, or weight gain, of kidney or liver problems, and certain patterns are specific warning signs. One-sided leg swelling with pain, warmth, or redness can mean a dangerous blood clot needing urgent care. and swelling with shortness of breath or chest pain needs prompt attention. So persistent, significant, worsening, or symptom-accompanied swelling warrants seeing your doctor to find and treat the cause, while those specific warning signs warrant urgent care. For benign swelling, elevation, movement, compression stockings, reducing salt, and weight management help, while swelling from a medical condition is addressed by treating that condition, and chronically swollen legs need skincare to prevent complications. So here's what I'll leave you with. First, understand that ankle and foot swelling is the buildup of excess fluid, often benign, from being on your feet, heat, inactivity, weight, medications, or vein problems, but that it can also be an important signal about your heart, kidneys, or liver, so it's worth paying attention to rather than always dismissing. Second, see your doctor about swelling that's persistent, new, worsening, significant in both legs or doesn't go down overnight, and especially swelling that comes with shortness of breath, fatigue, or weight gain, which points toward the heart so the cause can be found and treated. Third, know the urgent warning signs and act on them promptly. Swelling in just one leg with pain, tenderness, warmth, or redness, which can mean a dangerous blood clot, and swelling with shortness of breath or chest pain, which can signal a serious heart or lung problem. Fourth, for benign swelling, use the measures that help. Elevate your legs, move regularly, and avoid prolonged stillness. Use compression stockings if your doctor advises, reduce salt, maintain a healthy weight, and review your medications with your doctor. And fifth, care for the skin on chronically swollen legs and watch for breakdown or infection. Swelling in your feet and ankles is often just the ordinary result of gravity and a long day, but it can also be your body signaling something that needs attention, so the wise course is to manage the benign kind, recognize the patterns that warrant care, and not ignore meaningful or warning sign swelling. So take care of yourself, manage swelling sensibly, and get it checked when it's persistent, significant, or comes with the warning signs. And because finding the cause of meaningful swelling requires a doctor, and because some patterns are urgent, please treat persistent or significant swelling as your reason to see your own physician, and the warning signs as your reason to seek prompt care rather than as a substitute for that care.